Homeless and Hungry: How the Homeless Culture's Diet Affects Their Health by Carrie McClure, Linda Gomez Pena, and Cynthia Trickey. Homelessness. Homelessness, or houselessness, also known as a state of being unhoused or unsheltered, is the condition of lacking stable, safe, and functional housing. With this comes unstable everything, including eating habits. Our homeless population lack the dietary and nutritional requirements needed for them to live long, healthy lives. Studies show that most homeless people only eat 2 times a day, if that. Because of that lack of nutrition and dietary insufficiencies, in addition to other reasons that affect their overall health, research has shown that this population has about a 17.5-year shorter lifespan than the average population. Their poor diets are lacking healthy foods such as fruits and vegetables, but are high in intake of unhealthy sugars and fats. Eating habits within the homeless culture. It is important to understand that what a homeless person eats is a large part of their overall health. The homeless have inadequate food supply. Unlike most of the population, they are unable to get food when they want it or when they feel hungry. Many homeless people have other issues, whether it be addiction or mental health problems that drive them to drink alcohol or do street drugs, which is horrible for their health. A lot of times, when the homeless are provided food, it does not contain the proper nutritional value needed for them to stay healthy. Many homeless people are at times desperate for food and will dig through trash cans or dumpsters looking for food. This food can be expired, contaminated with other harmful items thrown out, or just bad from the elements it was exposed to. This can cause health problems for this population as well.
Homeless and healthcare. Studies found that food insufficient individuals, such as the homeless population, have poor mental health scores as well as higher incidences of illness and longer recovery periods due to lack of healthy and nutritious food choices available to them. It is very common for the homeless to have low intakes of iron, calcium, and protein due to their diet. Healthier food choices are often less affordable than foods high in salt, fats, and carbohydrates. The homeless population often only seek healthcare in extreme cases. Homeless people account for more hospital admissions and longer hospital stays than people from the general public who have the same exact health conditions. Homeless people have fewer visits to general practitioners than people with homes. This is not only from lack of resources, awareness, and trust in healthcare professionals, but also from biases and their fear of being treated unfairly. In summary, within an already difficult living situation with the homeless community comes difficulty with staying healthy and the many factors that contribute to that. More resources and education need to become available for not only the homeless, but the healthcare professionals treating them so they can better understand and have a better knowledge on how to properly treat and care for these individuals. There is never a harm in learning more and asking for help when it is needed.
NCLEX question number 1. A nurse is providing secondary prevention when working with the homeless. Which of the following best describes what is being implemented? A. Employer incentives. B. Safe sex education. C. Comprehensive case management. Or D. Soup kitchens. The answer is soup kitchens. D. Secondary preventative services target persons on the verge of homelessness as well as those who are newly homeless. An example of secondary prevention is a soup kitchen. Employer incentives and safe sex education are primary prevention strategies. Comprehensive case management is a tertiary prevention strategy. NCLEX question number 2. A community health nurse is caring for a group of homeless people. What is the most immediate concern when planning for the potential needs of this group? A. Finding affordable housing for the group. B. Setting up a 24-hour crisis center and hotline. C. Providing peer support through structured support groups. Or D. Ensuring that adequate food, shelter, and clothing are available. The answer is D. The question asks about the situation's most immediate concern. The initial community health concern is always attending to people's basic physiological needs of food, shelter, and clothing. Finding affordable housing and providing crisis intervention and peer support are meaningful interventions that may be completed at a later time. The nursing diagnosis is imbalanced nutrition, less than body requirements. The SMART goals are to increase daily calorie intake by 500 calories, weight gain of 0.5 pounds per week, adds nutrient-dense foods to meals, consults with a registered dietitian to develop a personalized meal plan, and reaches a healthy weight within 6 months. Interventions are to encourage patient to eat healthy foods and offer patient snacks and health shakes. The nursing diagnosis is risk for infection due to malnutrition. The SMART goals are increase daily intake of nutrient-rich foods such as fruits, vegetables, and protein. Record daily intake of food to meet nutritional requirements. Make meal plans that address nutritional deficiencies. Take supplements recommended by healthcare professionals. Achieve a healthy weight and improve nutritional status within 6 months. The interventions are encourage patient to follow up with a dietitian. Encourage patient to take supplements and medications as prescribed. The nursing diagnosis is risk for unstable blood glucose. The SMART goals are to monitor blood glucose levels regularly, keep a log of blood glucose readings, follow a meal plan that include a balance of carbohydrates, proteins, and healthy fats, exercise regularly to help regulate blood glucose level, and set a goal to achieve and maintain target blood glucose levels in a healthy range. The interventions are to offer patient healthy and nutrient-dense meal options, and to discourage patients to eat processed and sugary foods and educate that they are not a good source of nutrients.